My name is Jiles Smith, and welcome to our community.
I'm going to start with the history of how we were formed. In the 1950s, when the county mental health systems were being formed, Tri-City was formed because at that time there was a loophole in the system that if a community felt that their mental health needs were not being met by the larger county, this is before freeways were in existence, are not being met, they can form their own mental health authority. So in Claremont, the League of Women Voters got together with the cities of Pomona and Laverne, and they formed their own mental health authority. So we are the mental health system for the three cities of Pomona, Laverne, and Claremont.
I can't help from noticing your nice little green ribbon on your thing. What is that about?
So the green ribbon, it's the lime green ribbon. It is our mental health awareness color, and I wear this ribbon every day for mental health stigma reduction, so I can have a conversation, start a dialogue with even somebody in the line at Starbucks. Or even if I'm out in the community taking a walk, people do stop me sometimes, say, hey, what's the green ribbon for? That gets me to start the conversation about mental health and stigma reduction.
So in our pre-meeting, we were talking about your rise in the organization. So how long have you been working here?
I've been at Tri-City for 15 years now. And after being here for 14 years as the director of MHSA and Ethnic Services, I applied for the job of executive director. And I've been the executive director of Tri-City for more than a year now. So the goal and the mission, again, it is we are a part of the safety net. We work with our local law enforcement and provide services for every resident of our three cities of Pomona, Laverne, and Claremont, their mental health needs. And we do provide culturally relevant and top of the line services of mental health at Tri-City.
So is mental health a good career?
Certainly, I am biased, I would say, but it is the most rewarding career, I would say. It is you're working with people one-on-one as well as with communities at large, understanding their needs, and then delivering services based on that. So with careers in mental health, I wouldn't limit it to just having a master's degree or an MD and becoming a psychiatrist, becoming a psychologist, or a social worker, or a marriage and family therapist. There are many careers you can have in mental health. You don't have to go to college. You don't have to go to grad school. There's a career for you if you have a bachelor's degree in psychology, social work, behavior science, whatever that might be. There's a career for you over here at Tri-City, even if you never went to college. There is something for everybody over here, and it is a very, very rewarding career and makes you feel good at the end of the day that you made a difference in people's lives. So there are many careers, and they're all good. Mm-hmm.
Well, do you have interns or volunteers?
Yes, we do have service learners, is what we call our volunteers, because there is a service they are providing as well as learning at the same time. So it's a give and take. We give them the experience, and these are mainly students from colleges that are seeking careers in mental health. This way they get the real experience and they really know for sure that this is the career they want to have when they graduate from college or they want to go to medical school. We've had stories here where there have been volunteers who have spent a summer with us working at the summer camp at the Wellness Center and decided to go to medical school to become a psychiatrist. Of course, my pitch to them is, please come back and work here at Tri-City when you become a doctor. But we also have interns. We work with local schools and universities such as UCLA, Azusa Pacific, Cal State Long Beach, and many other universities. We provide internship programs for them. And again, our goal is to introduce careers at Tri-City to our interns as well as service learners, because Tri-City is a great place to work at. It's an awesome place. I wouldn't have been here 15 years.
So what keeps you up at night?
A few things that keep me up at night. We have made a commitment to the community to meet their needs and to serve them every single day. And I hope that we are meeting those needs. My goal is to go out in the community to meet with community leaders, natural leaders, as well as other community members, anybody, and talk to them about the services we provide and making sure that they feel that we are delivering the services that we are promising to them. So that is something that keeps me up at night, because I'm far removed from clinical services that are provided every day. But we do have the best therapists and the best staff that work at Tri-City. So we are in good hands when it comes to therapy and other services. But I just want to make sure that we are meeting the needs, the promise that we are making to the community. And the other thing we have right now, I am sure our Chief Clinical Officer is going to mention, is the shortage of workforce. There has been a historically low workforce that is entering community mental health, especially, and it has never been so low. But it is my message to the audience is it is a very good career, very rewarding career. Please do think about it, and please go into this field. It's really doing God's work. It's amazing.
So if they want to know more about this or careers, where can they go?
They can certainly go to our website, that is tricitymhs.org, or they can contact our Workforce Education and Training Supervisor, Amanda Colt, just by dialing the main phone number. And they can also reach out to our Human Resources Officer, and I am always here. My goal is to talk to every college student and train the workforce to enter into the mental health workforce. And so please know that I am here talking about careers, talk about my experience in the field of mental health. I've been in this field for 23 years now, and I have a great passion for this work, and I will convince you to enter this workforce.
Tell us about the stigma around mental health.
What I can say around the stigma around mental health is that it impacts all communities. That this is one of the things that I know a lot of work has been done in recent years to address, but what we really need to be doing is addressing it particularly with a targeted approach for each community, because they're experiencing it really differently. And what I would say is that we also need to look at that it's not just stigma that prevents people from coming into care. It's also the way we're providing care. If we are really reaching communities in the way that feels right to them, culturally, linguistically, and otherwise, then we will have more people being involved in the care that they need. We can't put all of the issues around engaging in mental health treatment on the hat of stigma, and that there's too much stigma and they're not attending. We also have, as a behavioral health community, have to own the mistakes we've made, the harm we've caused in treating people, and get right with providing culturally relevant care to all of our communities.
Well, speaking of culture, does race play a part in this stigma?
Race plays a really large part in it. What I can say about race and stigma is that different communities perceive mental health treatment in different ways, and that historically some communities have not been treated well by mental health providers. And that feeling that, I may not be treated well is something that behavioral health providers need to address and remediate and make sure that everyone feels welcome coming into care.
Is there an issue with intergenerational stigma?
Yeah, I would say that never before in our history have we had more access to dialogue. And you could say that, especially an older generation may say, we didn't have this kind of thing happening in my day. And what we know is that mental health issues have kind of remained constant about how prevalent they are. A little bit of a spike after the pandemic for a variety of reasons, but we know that they have always been there. What's different now is we're having dialogue. So we can say that perhaps older generations don't fully understand why. They may think it's more, or why this conversation is happening, when in reality there was a lot of suffering back then as well. We just have more access to having dialogue. So I think the thing we need to convey is that mental health impacts us all ages, all walks of life, all communities. And I think that's the dialogue that we need to keep having if we're really going to have an impact on changing stigma.
Well, how can we reduce the stigma?
It sounds so simplistic, but it is that continued conversation. We need to start thinking about mental health issues the same way we think about the common cold. In fact, one recent statistic I came across said that at around 46% of the population in the United States at one point in their life may be experiencing a diagnosable mental health issue. And I would, venture to guess that it's probably much higher than that. But if something that common is happening to all of us, we should be able to talk about it with ease. And so the way to do that and reduce stigma is just to keep the conversation going, and particularly listen to each other, learn from each other's experiences, because it is part of the human experience to experience mental health issues at some point in time. So my training is in social work. So I'm a licensed clinical social worker, both in the state of California and in Oregon, where I've done some work as well. And I was real intentional about choosing social work because one of the tenets of it is social justice. And that's kind of been my philosophy in how I approach mental health work, is that, yes, I'm going to be clinical. I'm going to provide the best evidence-based care that I can, and in my role as a leader, help my staff to do that. But we're also going to look at what's not working and what's not been fair, and we're going to address that as well simultaneously. They're not two divergent paths. If we're going to heal the person, we've got to heal the community, and we've got to right the wrongs. And that's kind of been my philosophy since I've gone into this work.
So what services does the authority provide?
Yeah, so Tri-City Mental Health Authority, we serve the communities of Claremont, Laverne, and Pomona, and we provide a variety of mental health treatment services. So we have outpatient treatment for children, youth, young adults, families, and adults, and older adults, and we serve them in a variety of capacities. So we have our intensive programs, which is known in California as full service partnership programs. So we have those available for children, youth, young adults, older adults. We have our people kind of understand as a more typical traditional outpatient, where you come in and see a therapist in one of our clinic sites. We have school-based programs where we're actually providing services in local schools and universities to our community. We also have we call our Access to Care program, which is a program where we help people access the care and treatment that's provided here. So intakes, assessments, helping them be evaluated. We have crisis response to people in need of crisis services. We also do housing services. So we understand that there's no mental health without housing. Like, we had to safely house folks. So we, through a variety of programs, either linking them to vouchers or providing permanent supported housing, or even additionally working with local landlords, we try to house folks that are in need of that as well. So one of our tenets and our values is to look at the whole person and provide care across that spectrum, whatever age and whatever needs they may have, because it isn't just the mental health issue they're coming in with all their needs, and we want to try as best we can to provide a holistic approach to care.
So why is mental health awareness so important?
Mental health awareness is so important because it impacts us all. And one of the things that I think that is particularly troubling is that recently death by suicide, which we often know as a byproduct of untreated depression and other mental health issues, recently became the second leading cause of death worldwide. The World Health Organization designated it second leading cause of death for people 10 to 30. And this impacts us all. It's a public health issue. Mental health is a public health issue, just like anything else, just like cancer, just like diabetes, just like any terrible pandemic that we have. We have to treat our whole self. And for too long, mental health and our well-being, our emotional well-being has been neglected, and we see the consequences. We see it in high mortality rates for people with mental health issues. In fact, people with mental health issues tend to die 20 to 30 years earlier than the general population. So this is having a devastating impact on communities, on families, in our population in general. So if we ever want to get to a place in this country and in the world that we say that we are healthy and we're taking care of one another, we cannot continue to put mental health on the back burner to other health issues. It's front and center with everything else, and we have to address it if we're really going to treat people and move towards wellness.
So when it comes to mental health awareness, what keeps you up at night?
What keeps me up at night is that we have a critical workforce shortage in the state of California. In the state of California, we have the largest shortage in the nation of healthcare providers and behavioral health in particular. And the need is so great here. We're the most populated state in the nation. We have more people that need help, and we have less people to provide that help. And my hope is that mental health workers, in whatever capacity, whether you be a peer support specialist or a social worker or a psychiatrist, we are valued in the same way that other professions are, so that we can recruit and retain high quality people to continue to provide the care. We got to take care of the people that are taking care of the people. And I'll probably sleep a little easier when we are able to say that we do that.
I know there's been a big push for mental health workers to go out with police officers. Is that something that your organization offers?
Yes, we do. We implemented this program, I would say about 4 or 5 years ago, where we go out with law enforcement. We meet them at the scene. We don't go in their cars, but we meet them at the scene once it has been determined that law enforcement is no longer needed and our staff will be safe in this situation. And we do respond as a team. We go with 2 people to the situation. And most of the time when there's some bad news being delivered, if somebody's lost a loved one in a car accident or something, we respond to those situations also with the law enforcement. We have trained all 3 law enforcements for our 3 cities, Pomona, Laverne, and Claremont, and mental health first aid. So these are trained officers that are going out in the community. They're trained in mental health. They're trained in recognizing the signs and symptoms and how to respond to those and when to make the call to us. So we do that. And also another program that is really successful in the city of Laverne is our Community Navigator program. Actually, we do have this service for all 3 cities. The community navigators are based in the community. Their offices are in community parks, City Hall, and other community centers. And we do respond to calls with law enforcement for those individuals also go out. And this is, again, once the officer has decided that and determined that it's going to be safe for our staff to be there, then we take over and we connect these individuals to services or whatever's needed at that time. So when we have a physical illness, we talk about it with our family, our friends, and the family and friends come together and take care of us. Whether it is cancer, it's diabetes, anything that you are now going to live with. The same way we need to normalize mental health and mental illness. It is a normal part of our daily lives, and there's nothing wrong with it. There's nothing wrong with it when you are asking for help. And please reach out to your loved ones that are struggling, that need your help. Reach out to them, and you reach out to others as well, asking for help. There's no shame in asking for help. Don't let mental illness be a part of you. Don't let it be your life. Let it be a part of your life, and recovery is possible. And we at Tri-City focus on recovery services over here as well.